Hello, my name is Kenan Widener. I'm a registered nurse at Lancaster General Hospital, as well as a student at the Pennsylvania College of Health Sciences. And today I will be presenting my service learning project that was conducted at Landis Homes. The three reasons that I chose to do my service learning project at Landis Homes were, first and foremost, the location. It was less than a 10-minute drive from my home. I drove past it numerous amounts of times over the past few months, and it piqued my interest about possibly volunteering there. I also have previous work experience in an extended care facility. When I was 16 years old, my first paid job was as a dietary aide in an extended care facility. So in a sense, sort of going back to my roots and my first experience in healthcare. I also had colleagues who had done their service learning project at Landis Homes, and they all provided excellent reviews about their experience. So the population that Landis Homes supports is broken down into different tiers. The residents live in either the retirement portion of Landis Homes, who they are completely independent otherwise. The healthcare residents require some care, some assistance with medications or activities of daily living, basic health care throughout their day. And then the personal care, those are individuals that require 24-hour caregivers. They're dependent on their caregivers. And there's also a unique population that they support, and that is the memory loss population. They have two separate adult day service programs where those with memory loss are brought in the morning and are picked up in the afternoon, but they are not actually residents of Landis Homes. So the needs of the population could possibly include medication management, activities of daily living, 24-hour care for those living in personal care, the social aspect, social engagement that the residents have, and also physical therapy, occupational therapy, that is all offered there. And then for those with memory loss, one of the key needs is supervision, which is provided through the adult day services. The healthcare professional's role in Landis Homes would be conducting activities. Some examples were bingo. We had a group walk and chat with the adult day services, escorting residents to activities, those that are wheelchair bound, getting them from their room to the activities, back to their room, to the dining hall, and then leading the activities and making sure that the residents are staying engaged in activities. Certainly there are your registered nurses who do mostly administrative work there. The LPNs do most of the medication and assessment and a wound care, and then the large majority of their staff is certified nursing assistants who do the activities of daily living, the baths, the cleaning, the wheelchair escort, and helping them engage in activities. A political role that the healthcare professional would play for residents at Landis Homes would be advocating for policies that benefit seniors. An economic role would be providing cost-effective care. So an example might be only taking the supplies that they need to provide care into a patient's room, so that supplies aren't wasted and costs are elevated. And then a unique example that I got to participate in would be fundraising. They have an annual day called Fellowship Day, which is a fundraiser that raises money for the residents at Landis Homes to bridge the gap between what they can afford and what Medicare would pay or what their insurance would pay. As of 2017, the average gap of what Medicaid will cover for an eligible resident at Landis Homes is $151 a day. So Fellowship Day was a unique opportunity to raise money to support individuals needing to meet that cost. And then for culture competence is important for any caregiver serving Landis Homes. It is a Christian faith-based organization, but understanding that there are different cultures, the Mennonite population, there are different religions, even though it is a Christian faith-based community, and being aware of those and the needs that they provide. For some instance, there are some residents who have had a family member, possibly their spouse that they were living with, may have died. They may or may not want to receive the mail that was intended for that deceased family member. I got to experience that in the mail room and working with the workers there, and them knowing which residents would and would not want to receive mail from their deceased loved one. So the service learning project, the design of that, I filled out a paper application. I spoke to the volunteer services coordinator over the phone, and then I had a 1-hour orientation, which included paperwork and a tour of the building. The implementation of my service learning project, I participated in running bingo, where I helped some of the residents fill out their cards. I actually helped a small table at one point fill out their cards. I was able to call the bingo. I helped check the bingo, gave out the prizes, which was chocolate. I worked in the mailroom sorting mail for the different houses, and I provided wheelchair escort to and from various forms of therapy, as well as the on-site barber. I also participated in adult day services. I helped to prepare and serve their lunch and dessert at lunchtime, and then take the residents on a walk after lunch and engage in a sit-down chat session, which I enjoyed and they really enjoyed as well. And then lastly was Fellowship Day. That was a day-long event in which I worked in the food tent, handing out and serving food, and then in the auction tent, moving items, displaying items, and as an auction runner. Some considerations if I were to do this in the future, or for someone doing this in the future. Most of the volunteer experiences at Landis Homes are 1 or 2 hours. So I started volunteering in August, and this class started in September. So I would recommend giving someone adequate amount of time so they do not feel rushed squeezing in those shorter volunteer activities. And it really would have benefited me as I became more familiar with the building. I could get residents to where they were going faster, get their back to the room faster. It would take me less time to get around. Knowing the organization and becoming familiar with the residents and the attendees of adult day services certainly would enhance what I could bring to the table as far as engaging them in activities or knowing what to talk to them about, or bringing in, for example, they were no longer able to provide sugar-free candy because it's expensive, so knowing that they are allowed to have sugar-free candy and, at one point donating that, but time would be the biggest consideration, having more of it. My 3 objectives: by the end of the volunteer experience, I will be able to state 3 benefits that seniors receive from adult day services. The first benefit they receive is supervision. They are supervised by both LPNs and CNAs. They are provided with both snacks. The second benefit is that they're provided with both healthy snacks and meals throughout the day from a nutritional aspect, whereas if they were at home, they may not be able to prepare and eat a meal themselves. And the third benefit is a physical aspect. Through the different activities that they do, they hold a activity session before lunch and then the walk after lunch. My second objective was, by the end of the volunteer experience, I will be able to describe how social interaction through entertainment benefits the resident's body, mind, and spirit. So the different social activities that they have, it's helping bone health, muscle health, helping them stay active. Bingo is helping them track both letters and numbers on two bingo cards. It's helping them with their fine dexterity and placing the chips on the card. And then bingo was another example of spirit. So many of them came out. There were 40 or 50 that would fill the dining hall, and they all really looked forward to it. They loved when I came to the door and said, "Hey, we're ready for bingo." That was definitely a spirit lifting activity. And lastly, by the end of the volunteer experience, I will be able to identify 3 benefits generated by volunteer service. The first benefit to me was I realized as I made time to volunteer that I actually felt like I had more time. Second benefit would be my own body. I felt like it was healthy for me to get up, be active. I wasn't sitting at home, eating, watching TV. I was engaging with the residents there. And then thirdly is a profound sense of fulfillment as I genuinely volunteered and gave my time willingly. It was a sense of fulfillment, and I definitely got back a lot from the residents that I worked with. The impact that I had for the population, I was able to get them engaged in activities, keep them involved in activities. I was able to give them my attention, and they had attention from the staff. When I was fulfilling other roles, then the staff was more free to fulfill roles to help the residents. Financial aspect would be helping volunteer at Fellowship Day. Variety and up to date, they really enjoyed asking me questions about technology, what was going on in the entertainment industry. I was able to provide them some of that. Personally, was a sense of fulfillment, a sense of returning to my roots, appreciation for what the healthcare workers do. There was a sense of sadness. Some of the memory loss was a little sad to see, as well as the death of loved ones from the residents that lived there, and also an appreciation for brain health and doing whatever one can to support brain health. And then professionally, I learned the roles of healthcare professionals in an extended care facility, the RNs, the LPNs, and the CNAs. I definitely, as I mentioned prior, have a better familiarization with working with those that have memory loss.